Menopause for women is a spectrum. Some women do not have a problem. Some women will come in and say, I'm waiting for something to happen. Shouldn't I be having hot flashes and night sweats and all my friends are doing this, but I'm not. And then some women really come in suffering, having a hard time, unable to sleep, losing kind of the joy of life. So it's really a spectrum of a time in a woman's life. I always try and tell patients it's a part of aging. We always laugh at, we do a lot of things to prevent aging, creams and this, but in general, we all have to age. And so it's more of a process. I don't want patients to think of it as a disease, because it's not. And I think that helps them understand that, okay, this is a natural part of getting older. But it's a spectrum. A lot of patients ask me about hormone replacement therapy. I still recommend it for certain patients, but it's definitely a tailored decision that we make together as physician and patients based on their symptoms, based on their risk factors. It's not a cookie cutter decision, and I have to explain the risks, benefits for the patient very clearly. But I still think it's a good option for many patients, but it's very much patient dependent. I get a lot of questions about bioidentical. Certainly anytime something appears on Oprah, it's always warrants a lot of phone calls for patients to their physicians. I have a lot of reservations about bioidenticals, and I talk to patients about my reservations. A bioidentical hormone is a hormone. It's not a safer hormone than a synthetic hormone. Sometimes it's actually can be harmful because the distribution, the bioavailability is not regulated. So it's not a regulated drug by the FDA. I think that patients look at it sometimes as being more natural. But there are risks to bioidenticals. If you do not have the correct balance between the estrogen component and the progestin component, you can be at increased risk for uterine cancer. When I talk to patients about alternatives or treatments for menopause, I always start with diet and exercise, because that's a part of women's health. It's a part of wellness in general. It becomes even more important as you get older. It's very common for patients to start to gain weight around menopause time. Their metabolism slows down, so that's always very, very bothersome, obviously, to patients. So we try to increase their activity. I try to give them, ways to fit that into their lives. I ask them about, what do you do in the morning? What do you do at night? Can you do this, a little bit of this? Can you do your DVD in the morning or at night when you get home? It's always better in the morning, by the way, because by the time you get home from work, it's really difficult. And sometimes that relates to sleep, okay? Sometimes people can get more sleep that way. I also do recommend some alternative therapies. We talk about melatonin, valerian root, some alternative therapies to help patients with symptoms. And it really depends on the patient. There are pharmaceutical medications that are not hormones that we use for menopause that a lot of patients don't realize that, we can give you a medication to help take away your night sweats. And one of the side effects is it makes you a little bit sleepy. That's great. You take it at night. And so we talk about all those things, and really, my job is to help patients decide, what's the best thing based on their symptoms for them.